So we got word today that Bronny James, he's the 18-year-old son of basketball star LeBron James, an incoming freshman at USC, had to be taken to the hospital and treated for cardiac arrest that happened during a practice. And it's not the first time we've seen this with athletes. Certainly, DeMar Hamlin comes to mind after he took a hard hit to the chest. I think back to when I was a kid, there was a jogger by the name of Jim Fix, somebody, that we expected, was in great shape and died of a heart attack. So these things happen. And thankfully, to get some expertise on this and learn a little more about it, I am joined by Dr. Kimberly Harmon with UW Medicine. And Dr. Harmon, again, appreciate you joining me. Firstly, I think, to my point that when we see athletes, we expect this sort of situation to be unlikely. But I was reading a little bit of a report that you had written. It really is probably a more common occurrence among athletes than we think, isn't it?
Yeah, sudden cardiac arrest in athletes, unlike in older people like Jim Fix, is typically caused by an underlying sort of condition that is inherited usually. And so there's things called cardiomyopathies, which are issues with the heart muscle. There's problems with the electrical system. And about 1 in 300 young athletes will have something that could potentially cause sudden cardiac arrest. So that's a lot. I mean, that's pretty frequent, 1 in 300. Obviously, not that many people actually have a sudden cardiac arrest. When we look at what the rate of sudden cardiac arrest is, it's oftentimes quoted as about 1 in 50,000, which is true. And certainly in our research in NCAA athletes, that's the number that we came up. But if you drill down a little bit into demographics, sudden cardiac arrest is much more common in male athletes. It's much more common in Black athletes, and it's more common in basketball players, white or Black. And so we're not quite sure why that is, but the rate of sudden cardiac arrest in 1 year for a Division I basketball player is about 1 in 5,000. And so then if you spread that risk out over a typical 4-year career, that's a little over 1 in 1,000. So that's a much different number just when you start to stratify it by different demographic factors.
So you actually dovetailed into the next question that I had that apparently you're not going to be able to answer, which was, what do we think is behind the higher rates in you had mentioned basketball, young men, and Black athletes. Is there any hint as to why those particular demographics might be a little more susceptible?
That's really the $1 million question, and we don't have a good idea about why these risk groups are higher. When you're looking at the difference in the rate between men and women, it's probably has to do with hormone type things. But then when you start to look at other like sport differences or race differences, we really don't know. There is some research showing that the social determinants of health can affect outcomes in terms of resuscitation. So if you come from a more disadvantaged background, you may be more likely to not get resuscitated, and so more likely to die. The numbers I've been quoting have been deaths that happen. And so many people actually have a sudden cardiac arrest and survive. In fact, if you're an athlete and you have a sudden cardiac arrest at a facility with an athletic trainer and an AED, some studies have shown that 89% of people will survive. And so if you're going to have your arrest, you'd like to have an athletic trainer on hand who can recognize it and sort of treat you.
And I'm glad you brought up the AED, the automatic electric defibrillator, because that is something, and this as a professional in your area, that they seem to be everywhere. You look now, every time I turn my head, I see one, on the wall, whether I'm walking through City Hall or going to the Seattle Storm practice facility when they do their thing, or wherever it might be. And you touched on it, but would you, talk a little more about the importance of having those devices readily available?
Yeah, there's sort of two things that are important. And one is the availability of those devices. And so you'll definitely see them at colleges, most high schools, you'll see them as you start to get down to lower levels of school, they're less likely to be there. But you should check, everybody should check their school and see whether or not they've got an AED there. The other places that you want to look for is like at the fitness facility you work out, or the gym where your kids are playing, AAU basketball, or the soccer field that your kids are playing. They're less likely to be there, and they're just important to be there. There was an arrest down at Starfire the other couple months ago that they just put an AED down, and the young woman's life was saved because of it. And so really important to have those AEDs available, because you can't use them if they're not available. And then the second thing that's really important is actually recognizing when an athlete has a sudden cardiac arrest. If an athlete collapses and is unconscious, they should be considered to have a sudden cardiac arrest until proven otherwise. If you put an AED on somebody that's not having a sudden cardiac arrest, it's not going to go off. Sometimes when an athlete, in fact, most of the time when an athlete goes down, they might have some seizure-like movement that can confuse people, or sometimes they'll have kind of gasping, agonal breaths, like a little, um, uh, uh, struggling to breathe sort of thing. But if they are unconscious, they should be assumed to be in sudden cardiac arrest. And you should sort of start the emergency action plan. And that starts with getting the AED on and calling the emergency services.
And you bring up another good point. The A in AED stands for automatic, and it's because they can detect whether or not it actually needs to shock the heart, don't they?
They detect whether shock is appropriate, and then some of them even talk to you and say, put the pads on, stand back. There was one study that was interesting where untrained sixth graders were able to apply an AED just as fast as trained paramedics. And so everybody can do it. They shouldn't be afraid of it. If you see somebody that's unconscious and down, you should grab the AED and get started.
And you make a good point there. I'm assuming, I haven't really looked at one in great detail, but they come with basic instructions. Put the pads here and step back and let it do its thing, sort of thing. Like anybody who can look at symbols can do it, right?
That's correct. And so the key for people who have AEDs is that it's not locked in a nurse's office somewhere so that you can't get it. The other thing is that the AEDs operate on batteries. And so if you have an AED in your facility, your school, there should be a plan to check and make sure that the battery's charged, every so often. And so there should be somebody that's responsible, and that's their job to do it. And then at schools, the people who might be likely first responders should practice an emergency response. Certainly here at the University of Washington, we practice our emergency response every year. Even though I've done it for years and years and years, every year we practice it again.
Okay, so I want to circle back because I went down the AED path, but I also want to talk about something that you had mentioned too, because you'd said it's not really clear necessarily why specific demographics might have a higher rate of sudden cardiac arrest, but you had also mentioned family history. How much do we find that a person's family medical history will play in, when they become an athlete who has experienced sudden cardiac arrest? Like, what do we tend to find?
Well, it depends on the athlete and the situation, of course. And I think what you're getting to is there's basically two types of prevention to prevent this from happening. One is to treat it with an AED after it's happened, and the other is to try and detect people before it happens, right? And so there is sort of standard screening that's recommended by the American Heart Association that asks things like family history and do you get chest pain when you exercise, and things like that. And that's typically part of a sports physical. What's not typically part of a sports physical that I believe should be part of a sports physical is an ECG, or an electrocardiogram, where they put those little stickers on your chest and they look at the electrical activity in your heart. And you can tell a lot of things about the size and shape of somebody's heart. And we can identify 2/3 to 3/4 of these things that can cause sudden cardiac arrest just from that ECG tracing. And so um, we're real advocates of doing that ECG screening, using the ECG to screen. So all our athletes, when they come into the University of Washington, get screened that way. And many athletes across the country do. It's not as common if you're just getting your regular sports physical, for high school sports. We also go out once a month to different high schools and volunteer with a program called the Nick of Time Foundation and do screenings in youth athletes to try and detect these things before they become an issue.
And you just said too, I think a key thing that it doesn't happen nearly as often in high school. I'm glad to hear that it happens more often, at least on the college level. But I would guess that
But wait a second. What I said is the screening doesn't occur as often at the college level. Actually, if you look at the total numbers of sudden cardiac arrest, because there's 8 million high school athletes and there's 400,000, 500,000 NCAA athletes, you actually get probably more numbers of high school athletes that have sudden cardiac arrest than college. We just don't hear about it as much because the things that we hear about are the high profile cases.
Like Bronny James, which is why we're talking today. And you did get me. I was referring to the screenings, but I wasn't clear with my question there. But that question I wanted to ask you was, even though it would have great value and capture a lot, as you say, before the worst might possibly happen, what's your sense that we would move in that direction, considering we're also talking about an added cost for hospitals and medical facilities and insurance companies to get all those additional screenings in there?
Right. I mean, I think that's the key issue is it practical? So an ECG costs about $25. So it's actually less expensive than a typical sports physical, right? I think the key is having somebody who can read it correctly. So there's certain criteria that we use to read an ECG in an athlete. How I'd read an ECG in a 15-year-old athlete is different how I'd read it in a 50-year-old man. And so there's certain changes that happen to the heart because the heart's a muscle, that are just a normal part of training related changes. And we don't want to you become all concerned with something that's just normal. And so you need somebody that can read the ECG correctly. There's something called the international criteria, which experts from all over the world have contributed to. And they sort of guide doctors how to read the ECG correctly. And so you need people who can read it correctly. And then the follow-up in terms of if the ECG is abnormal, that needs to be accessible as well. And so I never went, while sudden cardiac arrest happens probably more frequently than people think, I don't think that we want any type of screening, including just a sports physical, to become a barrier to sports participation. Because in general, participation in sports is beneficial to young people.
Yeah, I mean, we're talking about doing things to strengthen the heart, essentially, among other things, right?
Right. I mean, it's great. We know that exercise is one of the most potent things for health. And with increasing rates of obesity, it's particularly important. And there's a lot of psychological benefit to being part of a sport, part of a team as well.
So when we see a case like Bronny James or Damar Hamlin, they've gone back to playing. I mean, we don't know; it's too soon to know about Bronny James. I would assume that at some point, once he's checked out and everything's okay, he'll probably return to his sport. I can't imagine he wouldn't. Damar Hamlin. I mean, what do you tell people, athletes who have gone through sudden cardiac arrest and are concerned whether they should go on and return to their sport?
Right. That is like the perfect question. So, it used to be when somebody was identified with one of these conditions, either because they had a sudden cardiac arrest and survived or because they were found somehow, they were disqualified from activity. And things have really changed to sort of talking to the athlete about the potential risks, the potential benefits, and then with them and all the other people, their parents, their loved ones, the school, deciding whether or not participation is reasonable. And so that's called a shared decision-making process. But the thing is we don't know a lot about how people do after they've had a sudden cardiac arrest, when they've had certain things and they go back to this high-level sport. So we've actually started a study. It's called the ORCA study, the Outcomes Registry for Cardiac Conditions in Athletes. And what we are trying to do is to get elite athletes. Right now, we're just registering college athletes or professional athletes or Olympic athletes who've been identified with a condition that might cause sudden cardiac arrest or have had an arrest. And then we're following them over time just to see what happens. And some of those athletes will have chosen, like, hey, this isn't worth it, I'm not going to participate. And others will be like, I think for me, it makes more sense to participate than not. And what we're doing is try and look and see what happens to both their physical health and their psychological health. There was a recent study that came out in people with hypertrophic cardiomyopathy, which is one of the conditions that can cause sudden cardiac arrest. And it looked in people who chose to continue to participate in activity and those that were more sedentary. And this wasn't elite athletes. This was just sort of everyday people. And they saw that there's really no difference in terms of the outcome, in terms of how people did. And so if you can be happier sort of exercising and things like that, then, I mean, sports is very important to people for many different reasons. And so we don't really know. We talk about risk and benefits as best as we can, and then families, institutions, teams make a decision.
Dr. Harmon, what have I missed? What did I not think of that we need to consider as we look at not only Bronny James, but as this happens to people around us?
Well, I think you've hit on most of the important parts, but I'd like to reemphasize a couple of them. The first thing is to think about, having your child screened if you haven't, with an ECG. We do that here at the University of Washington Sports Cardiology Center. There's the Nick of Time Foundation offers screenings at different high schools. You can go to their website and look up area high schools where we'll be. So think about getting your child screened with an ECG. The second thing is, if an athlete collapses and is unresponsive, they should be assumed to be in sudden cardiac arrest until proven otherwise. And so if that happens on the baseball field, on the basketball court, wherever, you should just assume that that's the case and take appropriate action. And the third thing would be that AEDs really should be everywhere. And so if your local playground, field, school doesn't have one, you should look into how you might help get one and make that happen.
And I believe, and this is one, don't hold me to it because I don't have any solid information in front of me, but I feel like I've heard that there are programs available to help people help schools and gyms and organizations procure an AED either at a discount or at no cost. So at the very least, I would suggest, if your organization doesn't have one, see what you can get, your hands on, and save on those costs. All right, Dr. Kimberly Harmon with UW Medicine. Really appreciate it, doctor.
Thanks a lot.